Okay, so we're going to move on from the fibrous and cartilaginous joints, and we're going to spend the rest of the time on what are called synovial joints. And this is your basic model of a synovial joint. You have, I'm going to draw it on the side as well, so instead of going through this. So you have a bone, and you have another bone. Okay, so those two bones come together. And there's a space between those bones, and you have, I unfortunately don't have different colors on this pen, sorry about that, but you have cartilage that's on the surface of the bone. It's called articular cartilage, and that's made of hyaline cartilage, and there's articular cartilage here. So you have articular cartilage that covers the surface of the bones. But there's still space in between those two bones, and that space is filled with fluid. Okay? So there's fluid. Draw little waves here. So there's fluid in between those bones. Okay, so that helps that fluid, and that fluid's viscous. It's a gel-like fluid, so it helps those bones slide back and forth across each other. The cartilage, if it was just touching, wouldn't be tough enough to withstand the constant motion of all these joints. So you put a little extra fluid in there, and that helps those bones slide back and forth. And then you have a membrane that's around the joint, and this is called the synovial membrane. And it starts there and comes up there. And there's little cells that line the inside of this membrane. And these cells are called, they're epithelial cells because there's space on one side of them. And those are called synoviocytes, and they make the synovial fluid. So the fluid that's in there is called synovial fluid. And then, in order to keep this whole thing together, you have fibrous outer layer that goes down and goes all the way across the joint on both sides, all the way around. Not on both sides, but all the way around. So you have a synovial membrane inside and an articular, you have a fibrous outer articular capsule outside. So this would be the synovial membrane. And here's the fibrous, articular capsule. And then you have here is the articular cartilage. So that's your basic model of a synovial joint. You have space, you have a synovial membrane, and a space that's filled with fluid, synovial membrane that produces that fluid, and that's all encapsulated inside an articular capsule. Next slide. Here's the articular capsule is made of dense irregular connective tissue. You don't want it to be all dense regular connective tissue because it's going to be pulled in different directions. So you want this tough. You want a tough, fibrous, irregular connective tissue around the outside of that, around the outside of the joint to hold it all together. Next slide. On the inside, where you have the synovial membrane, it's all loose connective tissue, and you have well, it's not all. It's underneath the fibrous articular capsule, but on the outside of the synovial membrane, you have this loose connective tissue, this areolar connective tissue, and it's and then you have a layer of epidermal cells right on top of that on the inner side, making the synovial fluid that flows into the joint. Next slide. So, and just showing hyaline cartilage. This is the articular cartilage. Is made of hyaline cartilage, so the articular cartilage that's on the ends of the bones is made from hyaline cartilage. Just a reminder. Next slide. So we're going to summarize the joint classifications. You have fibrous, cartilaginous, and synovial joints, and you can read through this this table later. I just put this in here just to help you give you a different way of looking at all these at the joint classifications. Next slide. And here's a picture showing different examples of classifications of joints. So, for instance, number 1 up here, it's a synovial joint, so it's obviously going to be a diarthrosis. They're all diarthroses, and each diarthrosis is synovial. So this is the shoulder joint, the glenohumeral joint, where the glenoid capsule or the glenoid cavity and the head of the humerus come together, the shoulder joint. Number 2 is the elbow joint. That's also a synovial diarthrosis. You also have, then we have a cartilaginous amphiarthrosis, the pubic symphysis. Number 4 is a metacarpophalangeal joint. So the metacarpal, this would be metacarpal 2, and connecting with proximal manual phalange, number 2, that joint there. Then number 5 is a fibrous amphiarthrosis joint, but it's not synarthrosis. Usually fibrous are immovable synarthroses. This distal tibial fibular joint is a amphiarthrosis. Then we have number 6 up here is skull sutures. Those are fibrous and synarthroses, as opposed to number 5, which is fibrous but an amphiarthrosis. So then number 7 is cartilaginous joints. They're also amphiarthroses. The intervertebral joints. Then you have number 8, cartilaginous and amphiarthrosis, the manubrial sternal junction. Number 9 is we're back to a synovial and diarthrosis, the acetabulofemoral joint, the hip joint, where the acetabulum and the femur come together. And then we have another synovial diarthrosis, which is the tibiofemoral junction, the femorotibial joint, or the knee joint. Okay, next slide. Those are just examples of joints. And okay, next slide. Back to the tooth. This is a synarthrosis, fibrous joint, and it's called a gomphosis. And I just want to show you, this is a diagram of the Sharpey's fibers. You have the periodontal ligament and the Sharpey's fibers. You can see them going actually into and penetrating the dentin of the tooth. This is the tooth here, and this is bone. This is your skull bone over here. It's either mandible, or I guess since it's pointing up, that would be the mandible. And so it shows the Sharpey's fibers penetrating here from the periodontal ligament, and also penetrating over here. So that's how it holds the tooth in place. It penetrates into the bone on both sides, into the bone on one side of the dentin, the specialized bone on the other side. Next slide. If you want to take out a tooth, you have to use a little tiny sharp knife. It's called a periotome. And here's some examples of some periotomes. And you dig in around that tooth and cut that ligament all the way around the tooth. And then you pry it out. So, yay, fun stuff. Next slide. Here's some actual photograph of actual Sharpey's fibers. So you have the periodontal region, and you have the tooth is here, and so you have Sharpey's fibers coming across into here. Next slide. Just to remind you, the compact bone structure, and here again are the Sharpey's fibers. They're perforating into the actual bone tissue and hold the periosteum onto the bone. So it makes it very hard to peel off. And then the ligaments and tendons attach to that periosteum and into that. So it helps those hold on to the bone. Next slide. Just another example of the perforating Sharpey's fibers, what they would look like right there. Next slide. And I did this again. Sorry, I had 3 of these in a row apparently. So Sharpey's fibers, once again, showing them there. So next slide. This is showing muscle attaching to a bone through the tendon. So here's your muscle up here and a tendon, and then it hits the periosteum, and the periosteal perforating Sharpie's fibers help connect that tendon down into the bone. And so it holds on there. So it's really well connected to the bones. This is why you can get, if you have a severe muscle tendon pull, you can actually rip part of the bone off. It's called an avulsion. Avulsion. So you actually tear part of the bone away rather than the tendon tearing. It actually tears away some part of the bone there. And so, so it's two different ways that you would treat those kind of injuries. Next slide. We'll talk a little bit about osteoporosis. It's interesting. We talked about it in terms of calcium and needing vitamin D and all those kind of things, and how your bones can lose calcium and also gain calcium through the osteoblasts and osteoclasts system. It turns out also, if you stress your bones, if you do weight-bearing exercises, then you will actually increase the amount of bone density that you have, and it actually will help. It won't prevent osteoporosis, but it will help you. Your body does respond to weight-bearing exercises. It doesn't have to be heavy weights; it can be body weight if you want to do those. But the point is to remain active throughout your life. So this is normal. This would be B is where your belt bone is stressed, and you can see the increase in thickness of bone as compared to over here. And then osteoporotic bone, osteoporosis kind of situation, you start losing bone, and the bone gets even thinner over here. So you can see how so if you continue exercising throughout your life, you can actually stave off a lot of effects of osteoporosis. Next slide. So, okay, and we talked about the basic structure of synovial joints, synovial cavity, articular cartilage, the joint capsule, fibrous membrane, synovial membrane, and the synovial fluid. One of the things to just remind you that the hyaline cartilage covering the bones, water makes up about 80% of the articular cartilage by weight. So be good to your cartilage. So keep drinking water, stay hydrated, and it will help. It just helps your body. You can make synovial fluid, and you can also keep your cartilage nice and full of water, and that provides a lot of cushioning. And the more cushioning you have, the less likely your bones are going to be to smash against each other. And all right, next slide. So you also have on the outside of the synovial joints, you have ligaments. You also have some other things that are in joints. There's a meniscus, bursa, fat pads, and tendons. Tendons connect the muscle to the bone. Ligaments at the top. So tendons connect muscle to bone. Ligaments connect bone to bone. And you have some that are outside the joint capsule. Those are called extrinsic ligaments, and some that are inside called intrinsic, and they're fused to the wall of the joint capsule. They have some that are actually within the capsule called infracapsular. They connect bone to bone and hold joints together inside and outside the capsule. Meniscus, you have fibrocartilage pads. You have a couple of those in the knee. We're going to talk about those. They're shock absorbers, and they help provide a nice close fit between the surfaces of the bones. We're going to take a look at why we need those here in a little bit. Then bursa. So we talk about the synovial membrane. Well, bursa are just little flattened sacs that have a synovial membrane on the inside. Which produces synovial fluid. So you get this little tiny fluid-filled sac, and it provides extra cushioning. And you have a bunch of these little sacs, scattered around inside your knee. I think there's I forgot how many there are. I think there's 17 in the knee. And they help reduce friction between structures that rub against each other. For instance, skin and bone. So you can have a bursa between skin and bone so that you can move your knee back and forth, and the skin doesn't rub. You also have some that are underneath the muscle, submuscular bursa. There's a little between the muscle and bone, and also ones that are between the tendon and the bone called the subtendinous bursa. So there's a whole bunch of those, especially around the knee, and there's various other places. You also have fat pads in around these things. We're just adipose tissue structures that fill space between articular capsule and the synovial membrane, so that you have a little bit of cushioning in there. Next slide. So here's some examples of bursa and fat pad and tendons. So we're going to start at the top. You have the tendon of the quadriceps femoris. So here's your quads up here. Here's your quad. And then here's your tendon of it coming down here. And then you have your patella. And so underneath the patella and the tendon of the quadriceps femoris, you have a suprapatellar bursa. It's a submuscular bursa. Then there's on top of the patella, between the patella and the skin, there's a prepatellar bursa, subcutaneous bursa, subcutaneous meaning below skin. And we have a synovial cavity inside there. Then we have an infrapatellar fat pad, so they have patella here, and we have a fat pad down below it here. There's a fat pad. Then we have an infrapatellar bursa, subtendinous bursa, so you have the patella and you have the patellar tendon coming down here and connecting down here to the tibia. And so we have a bursa. So there's a bursa there, there's a bursa here, and here's a bursa here. So that's just showing 3 of the bursa. So, and this is your femur, here's your tibia here, and there's also we'll talk about these in a minute, the anterior and posterior cruciate ligaments here in a second. Next slide. I just want to show you, in this slide I just want to show you where the bursa were and what they did. You don't have to know those for the test. I'm not going to ask you to label those in the test. I just need for you to know that there are these bursa there. They're fluid-filled sacs filled with synovial fluid that help reduce friction. Next slide. So we're back to the synovial joint diagram. We're going to go through this over the next few slides. Next slide. This little bit closer view up of this. So we have the synovial membrane here. We have articular cartilage, this is blue part here. Here's more synovial membrane. So this is making all the synovial fluid here. Okay? It's all inside there. And we have this is a section through a finger joint, so between the middle and proximal phalanges. And we have so referring to this as articulating bone and articulating bone, those 2 bones that articulate. And then on the outside, you have this fibrous, oops, a little wild with a pin there, this fibrous membrane called the articular joint or joint capsule. And you can see that it attaches into the periosteum here. So, next slide. Here's an actual cadaver showing the articular cartilage, and there's a fibrous membrane on the outside here, showing it there, and then the synovial membrane is in here, and you see a little tiny bit of a gap there, and then you see a lot of a gap here. There's not nice space between those two articulating bones, and this is the hyaline cartilage here along the end of the bone and there as well. So next slide.